This piece of work is very much looking at children and young people, how they perceive healthcare needs, healthcare provision in the Reading area, what they want from it, and also what they don't want from it. So, for example, I've heard some children already say to us this morning that they really think that doctor surgeries are fantastic at providing facilities for little kids, but there's not a lot when you're 9 and 10 and 11, when you're in the waiting room, and it's a bit boring. We've also heard lots of positive things about how kind people are in dentists and doctors, how kind school nurses are. So this morning so far the children have been doing a piece of work, and we've been trying to find out about what health messages they've already had. So what do they know? Do they know anything about cigarettes? Do they know anything about healthy eating, sport, keeping fit? So sort of wider health issues.
Well, you should be drinking lots of fizzy drinks a day, and not ones with lots of sugar in. That will rot your teeth.
We should be eating about 5 fruits per day and a lot of not a lot of carbohydrates, but some carbohydrates per day.
It's a piece of work that's never been done, for starters, so us grown-ups, we all assume we know what kids want from health services, and so we can fall into the trap of just giving them what we think they want. Well, has anybody ever asked these children what are their thoughts? Where do they want to be seen? Who do they want to see? How do they want to be spoken to? Who do they want to go with? So there's all sorts of issues sitting in there, which will then lead us on to a later piece of work, which is going to be with teenagers. We know that the standard of oral health, for example, in Reading is very poor. We know that there's issues about teenage pregnancy within Reading. So the answers that we get from the youngsters today will help form our questions that we then ask the teenagers at a later event. Loads of positive stuff from kids, which is great, and that's really empowering for the current healthcare providers out there, so that we can say, you know, the kids think that doctor surgery is a fab, but hey, can we have some positive messages up on the wall, like be brave? That's something I've heard a lot of the children say today. What about toys? What about activities for kids when they're waiting? And some of the kids have said some interesting things about they want a leaflet which explains, say, healthy eating to them, something that they can understand at their level of literacy, with lots of pictures. So there's a real interest here from the kids.